Welcome to week 24 of the Mama Stay Fit Pregnancy Week by Week Update. In this video, we're going to share what is going on with your baby during week 24 of pregnancy, what might be going on with you, and then I'm going to share how I am feeling currently in my 24th week of pregnancy because I am also pregnant with you with my fourth baby. You might not be on your fourth baby. That's okay. But comment below to let us know how you are feeling during your 24th week of pregnancy, or if you're just pregnant in general and just happen to be stumbling across this video, because we would love to connect with you on your journey. Before we dive into what can you expect during week 24 of your pregnancy, I want to share that my book, Training for Two, is now available for pre-order. Training for Two helps to navigate you throughout your pregnancy with your fitness. So there's lifting modifications for each trimester. There's also pelvic stability and core exercises that you can do throughout your pregnancy, plus exercises that you can do to prepare your body for birth with pelvic opening exercises and pelvic floor release exercises. You can check out Training for Two down in the notes below. So Roxanne, what can we expect for baby in week 24 of pregnancy?
So week 24 of pregnancy is kind of a big milestone. So if you watch last week's, this could be considered viability for last week in some hospitals. But for most hospitals, week 24 is the time where if you went into preterm labor, they can do measures to be able to save baby. So baby can survive outside of the womb around 24 weeks. So it's a very exciting moment. So a lot of labor nurses or NICU nurses, this is like a celebration that we do when we're working to be like, yes, like you could do stuff to save my baby now. And it's like an exciting moment. But at week 24, baby is the size of an eggplant or Mr. Potato Head, but like the full size normal Mr. Potato Head. There are some potato heads that are like this big. I think you have some that are like Ninja Turtles. That is not the size of baby. It's like a normal potato head, which is like, I think like this big. Which that's a big eggplant.
I mean, eggplants are pretty large.
I forget how big eggplants are because I just think when you slice it, they're like this. Yeah, I guess an eggplant's pretty big. But Mr. Potato Head is resonates with me more. But during week 24, baby is starting to chunk up a little bit. So they're starting to put on some fat and they're starting to kind of like be proportional in size. Their heads are always going to be slightly larger than the rest of their body. Like babies just don't have like a proportional size head. Like they can't do this. But they're starting to be not 50% head, which is what they are prior to. And they're starting to actually put on some fat. So they're starting to like develop those little baby rolls. Their skin is still transparent, but it's starting to, as they put on more fat, it's starting to become less transparent. This is also the time that they're starting to like produce this protein and fat in their lungs called surfactant. Surfactant is like the oil and the lubrication for the lower part of our lungs. So we have little sacs at the bottom of our lungs where the gas exchange occurs in our body. So like the oxygen and the carbon dioxide is exchanged in these sacs. But without surfactant, they're almost like stuck together. It's really hard for them to open and close. But surfactant, we all produce it in our bodies, and this is when babies are starting to produce it in their bodies within the womb to allow it to be able to open easier and allow that gas exchange to occur. So it's like lubrication for the lower portions of your lungs. Baby is going to be producing this from 24 weeks until they're around term to help allow those alveolar, so those sacs at the bottom of the lungs, to open. Sometimes if babies are born prematurely, we can give surfactant to them to allow their alveolar or those sacs at the bottom of their lungs to be able to open a little bit easier so that they can survive outside of the womb. Another thing that's happening at 24 weeks is that their nostrils are now open. So they're actually able to breathe through their nose, which most babies when they're born are nasal breathers anyway. So this is a really great time that now they're able to practice breathing through their nose. Obviously, they're only breathing in amniotic fluid right now, but this will allow them to, when they're born, be able to breathe through their nose. And then the last thing that's happening in week 24 is within our ears, we have this like tiny vestibular system. It's like little tiny system within your ears that kind of controls knowing what is up from down. It's like your balance. So like when you have something stuck in your ear or it feels like you have like fluid in your ears, you kind of feel a little bit off balance. And this is when it develops, is at week 24 during your pregnancy. So before week 24, babies don't really know what's up and down. So that's why if your baby is breech before week 24, it's not a big deal because they know what is up from down. Whereas after week 24, around week 28, that's when like babies who are breech potentially may need some assistance to like help turn by creating more space, because maybe their vestibular system is off or they just don't have the room to be able to turn head down. So creating this space around that time is beneficial. But prior to 24 weeks, they really don't know it's up from down because that vestibular system hasn't fully developed yet. That's really it for baby. For you, though, I mean, you're still second trimester, so all of the usual symptoms of kind of a burst of energy, might have the itching and all that. But other things you might notice is, again, that red swollen gums. So like flossing, I feel like I would floss during pregnancy and my like gums would just bleed instantly. This is a completely common thing that happens during pregnancy, and this is due to like the increases in the different hormones that kind of allow for pregnancy to continue, but also like the increase of blood flow within like our entire body to include our mouth. So all of those things contribute to the red and swollen gums, which is just not fun.
But a fun fact that you may not have known is with your dental insurance, usually they'll cover an additional cleaning during your pregnancy. So typically it's like one every 6 months, but during pregnancy you can get an additional one because the risk of developing cavities and oral health issues does increase during pregnancy because one, we're probably throwing up a little bit more. Maybe you have a super sensitive gag reflex and you can't brush your teeth as often as you would like. We also have that increase in hormones and blood flow, and so there's more movement happening within our teeth. And so there's a lot of factors that can contribute towards increased cavities during pregnancy. And so that additional cleaning can help to prevent issues and then also help you in the postpartum as well.
And our oral health has been tied to pregnancy complications as well as preterm birth and other like infections. So a good oral hygiene is beneficial during pregnancy. And so seeing a dentist is recommended. Other things that you might be experiencing at week 24 is you might start noticing that you're having more back pain. They say about 50% of people experience some sort of back pain during pregnancy. And so you are not alone if you are having pregnancy discomforts.
It's important to note that even though pain is a common occurrence during pregnancy and almost expected to happen during pregnancy, it is not a requirement. So you do not need to be in pain in order to be pregnant because there's a lot of stuff that we can do to help support our comfort throughout pregnancy. First, you are allowed to work with a pelvic floor physical therapist even during pregnancy. So if you are having pain that is impacting your daily life, working with a professional in a one-on-one setting, either in person or virtually, can be incredibly beneficial to figure out, can we find a solution to your exact reason for pain? The next thing that we can do is we can focus on strengthening exercises. During pregnancy, there's a lot more movement happening within our joints, and this is important to allow our pelvis to create more space for our baby. But this can kind of impact a lot of the joints within our body. And so doing strengthening exercises can help to improve the stability of our joints. And then the third thing that you can do is we can add external support. So like a belly band is a really great option to add into your comfort routine, especially if you're going to be up on your feet a lot. You can get some like seat cushions to sit down on to like help support your pelvis and bring it into a better position, or even getting like a birth ball to sit on if you're at like your desk a lot. And so we can incorporate different things to help improve our mobility and help to provide external support during pregnancy. Because again, it is not a requirement. The solution to pain relief is not to give birth. There's stuff that we can do during pregnancy. If you want those specific exercises, we do incorporate them within our prenatal programs because you don't have to be in pain during pregnancy.
And if you're looking for an external support belly band, one of our favorites is from Balbe that we'll link in the notes below. Another thing that you might be experiencing in week 24 is you might start noticing babies moving a lot more than they were previously. It's still not time that you need to start doing those kick counts just yet, but maybe you start noticing what baby's normal movement pattern is. It's like, when are they a little bit more active and when are they not a little bit more active? And then the last thing that we can start preparing for, or like you might be doing this at your next appointment, is our gestational diabetes screening. So gestational diabetes can develop, and it usually is more pronounced starting around the end of the second trimester into that third trimester. So this is when they normally will test for it between 24 to 28 weeks gestation. Gestational diabetes is a complication that can develop where it's like you are becoming insulin resistant. So the insulin that your body is creating is not working as effectively to lower your blood sugar levels. And this can lead to some complications if it's not either identified or addressed and controlled. And we did an entire episode on gestational diabetes with Lily Nichols, who is the subject matter expert on gestational diabetes, the risks for pregnancy and for baby after pregnancy, that we'll link in the notes below. With gestational diabetes, though, a lot of people don't like the glucola because there's preservatives. It doesn't taste great, and they don't like that feeling that they get after. So it's about 50 grams of just pure sugar that you're drinking within 5 minutes. And then after an hour or 2 hours, sometimes in some clinics, they'll retest your blood sugar to make sure that it is within the optimal range, and that means that you don't have gestational diabetes. If you are outside of that range, it just means that they need to screen you further for gestational diabetes. So the first one is just a screening. It doesn't say whether or not you have gestational diabetes. This requires you to then do the diagnostic test, which is a 3-hour test. You drink 100 grams of glucola or sugar water pretty much, and then they test your blood sugar at 3-hour intervals. So 1 hour, 2 hours, and then 3 hours. And then depending on those levels would rule you in for gestational diabetes. So the glucola drink is the one that is most commonly offered, and it's well studied, and it's perfectly safe for you to utilize during your pregnancy. It's something that we both utilized in previous pregnancies. If you're looking for an alternative, though, to the glucola, talking with your providers can be beneficial to see what alternatives they would utilize in their clinic. The fresh test is a preservative-free option, but it still has the same amount of glucola, and it is FDA approved for glucose testing in pregnancy. So this is a great option if you're looking for one that has no preservatives, and we have found that it doesn't lead to that same jittery feeling after drinking it. This does come in a cool lemonade flavor, which the glucolas can either be flavorless, which not my favorite, or lemon or orange. I've found that those are the most common flavors that you can find of the normal glucola common drink. But this one is a really fun minty lemonade, and I really enjoyed this flavor a lot. They come in a powder that you can mix yourself. So some clinics will be able to provide this. Our clinic provided this for an additional fee, or you can buy it yourself and bring it to the lab to do your glucose testing. Again, they have a powdered version, or that you can buy the pre-mixed version, and this is all you have to bring, and you don't have to worry about mixing it. Again, with that gestational diabetes screening, you're going to be taking it between 24 to 28 weeks. So if you're not taking it at this prenatal visit, just be prepared that at the next prenatal visit, they might recommend it. So Gina, how are you feeling?
Overall, I'm feeling pretty good. I feel like I say that every week, but workouts have been really consistent. I felt like I've had a big boost of energy as well during the 24th week of my pregnancy, which is surprising. I feel like I should be decreasing in energy, but it continues to spike upwards for me. I haven't had the usual pelvic pain that I normally start having at this point during my pregnancies, and I think it's because I've been really consistent with my workouts lately, so been feeling pretty physically good with my body. I have been using more external support devices though to help with my comfort as well. So I've been wearing the belly band when I'm going for walks, or if I'm going to be on my feet a lot, to help just provide some more support for my belly, because it does feel like it's just getting so much bigger, so much faster. I have no idea what position baby is in right now, but again, at this point, I'm not super concerned whether she's head down or whether she's breech. But at 28 weeks, I'll be taking my gestational diabetes test, and also will be getting a growth ultrasound at that point, just to make sure that she's on the right trend, because I do have some thyroid issues. And at that point, I'll know whether or not she's head down or breech, and then I'll be a little bit more deliberate on helping her get head down if she's not. But hopefully she is, and it's one less thing that I have to worry about at that point. This week, I did have another appointment with my provider, which is not my OB provider or my midwife. This is just a normal doctor that I see regularly for my care, to check out my thyroid levels. So I see him every 4 to 6 weeks. We do lab work to look at my thyroid levels. We're looking at the free T3, free T4, and the TSH levels. And then during pregnancy, your thyroid reference ranges actually change them outside of pregnancy. And it also depends on the trimester as well. And those ranges are much more narrow too. And so he's very precise with the measurements that he's looking at, and the numbers that he's looking at. And so we didn't have to adjust my medication this week, but we anticipate in the next 1 or 2 months, I'll probably have to increase my thyroid medication dosage. And then postpartum, it'll kind of taper back down again, because my pre-pregnancy, it was 0.25, and now I'm at 1 with my dosage of it, whatever number those are. But it did increase for me during pregnancy. My thyroid level has been really well managed, which is super important. This is why I get those growth scans throughout my pregnancy, because my thyroid can really impact baby's growth and development as well. And so if you were concerned about your thyroid or you're wondering if there's like anything going on with it, this was something that I was looking at pre-conception, which if you're watching this, we're beyond that phase. You're probably pregnant at this point. But you can get your thyroid levels checked throughout your pregnancy. Typically, the recommendation is like every 4 to 6 weeks, just because it can fluctuate so much. Some signs and symptoms that I had noticed pre-pregnancy to let me know that my thyroid was maybe not functioning super well was that I had really low energy levels, lots of brain fog, and then also a super low appetite. And so when I do take my thyroid medication and I also get B12 shots combined with it, I do find that I have more energy, my appetite increases, so I can eat more food regularly like you're supposed to. You're not supposed to eat like a bird, apparently. And that really has been helping me throughout my pregnancy to just feel more energized and to also help to support baby's development. So, yeah.
So cool.
So far, he says it's perfect. My thyroid's perfect.
Well, I mean, it's not perfect.
I mean, it is with some help. We can all use help. So thanks so much for watching week 24 of the Pregnancy Week by Week update. Let us know how you are feeling in week 24 of your pregnancy. If you're doing your gestational diabetes test this week, let us know what option you chose, because some providers actually will offer some different variations as well. So you can either do the glucola drink, which is perfectly fine to take. I took it, I think, during 2 of my 4 pregnancies. My last pregnancy, I did the fresh test. I found I wasn't quite as jittery with it. I thought it tasted really good. I didn't mind the glucola drinks, though. That was a free option for me at my clinic as well. I had to pay like $15 for the fresh test, which, again, it tastes a lot better. I didn't feel super jittery, which I appreciated. So let us know what option you're choosing for a gestational diabetes test, and if there was options even presented to you. Like, were you given options for it? Because I think it's really important to have an option and then make a decision on what feels best for you and for your baby. If you want more support throughout your pregnancy, check out our online prenatal fitness programs. We offer our online prenatal fitness programs in 2 formats. We have our app-based program, which is a list of exercises with short demo videos, and this is going to be self-paced workouts. So if you want to work out with a barbell, you want to work out in a gym setting, this is the app for you. If you prefer to watch a video and work out with it at the same time, our prenatal on-demand can be a great option for you as well.
And if you're looking for a childbirth education course, check out our online childbirth education course where we break down the science of birth to help take away that mystery and make it less scary. In it, we discuss labor positions you can utilize, different birth options to include pain relief, both pharmacological like medication and non-pharmacological, as well as what can your partner do to help support you during labor and birth. This has lifetime access, so you can use it during one pregnancy and then use it again in subsequent pregnancies. And you can check out all of our offerings on our website at mamastayfit.com. And as a thank you for watching this entire video, you can use code YouTube10 to get 10% off any of our offerings, to include our prenatal, fitness, education, as well as our postpartum fitness and education. And if you're a professional, we have professional courses for prenatal, postpartum fitness, and birth workers.